As I said in my first speech, the health and wellbeing of every Victorian and every resident in Pascoe Vale, Coburg and Brunswick West is paramount. Regardless of age, income, background, location or circumstances, all Victorians deserve access to world-class and accessible healthcare. That is why Labor has been investing record amounts into our health system and backing in our doctors, nurses, paramedics and community healthcare workers to make sure every Victorian can get the care they need when they need it. But just as importantly, it is also critical to ensure health workers have quick and efficient access to the information they need, particularly in crucial situations when a diagnosis is critical, or when a patient's life hangs in the balance. And that is what this bill is fundamentally all about. It's about giving doctors, nurses and health workers access to the health information they need for patients so they can do their jobs, save lives and support the health and wellbeing of all Victorians from all of our electorates. We trust our doctors, nurses and healthcare workers with our own lives and the lives of our families and loved ones. We can and should trust healthcare workers with the health information of patients when they need it most. Speaker, currently in Victoria, while doctors, nurses and health workers do a magnificent job in helping Victorians, particularly more than ever during the pandemic, the reality is that critical health information that they require to assist patients largely remains spread across different health services in separate systems and in paper-based records. This fragmentation of patient and health information often means that many clinicians across our system still manually gather patient health information, including through fax or phone calls. Whilst improvements have been made over recent years, the system still largely remains inconsistent with modern health record sharing approaches that have been adopted by other Australian jurisdictions such as New South Wales, Queensland, the ACT and South Australia, all of whom have successfully implemented information sharing technology at the point of care. The Health Legislation Amendment Information Sharing Bill will finally enable better information sharing between specified health services across Victoria through the establishment of a secure platform that is operated and managed by the Department of Health. The bill will amend the Health Services Act of 1988 to establish a health information sharing platform for relevant health services to share certain information for the purposes of specifically providing medical treatment and care to patients. The amendments will also authorise the collection and disclosure of health information to the Secretary for the purposes of establishing and maintaining the electronic health platform, and will apply to some of the following specified entities, including public hospitals, denominational hospitals, prescribed health services, registered community centres, the ambulance service and the Victorian Centre for Mental Health and Wellbeing. The application of the bill recognises the challenges of siloed information across the public health care system and the importance of strengthening the system for the health and wellbeing of all Victorians. A consolidated picture of a patient's medical and health history is essential for the provision of the safe and high-quality care across our health system. Deputy Speaker, this is a bill that has been developed on the sound and trusted advice of health and medical professionals. It is a bill that stems from and responds directly to the findings contained in the Targeting Zero report, which reviewed hospital safety and quality assurances in Victoria in 2016 and highlighted opportunities to strengthen quality care and reduce avoidable harm in the health system through better patient data management and information sharing. The Targeting Zero report consisted of in-depth consultation with many across the health sector, including stakeholders working in various branches of government, hospitals, not-for-profit organisations, private industry and academia. Over 50 hours of interviews, 5 workshops involving 320 hospital board members, CEOs, leading clinicians, directors of nursing and medical services and other health sector staff. And the report put forward a number of key findings and recommendations which this bill is now seeking to directly deliver on. In this regard, I would like to draw the House's attention to a number of key excerpts from the report which directly relate to the need for this bill to be progressed and supported. As stated over page 12 and 13 of the report, the review found, and I quote, "Information is the lifeblood of a continuously improving hospital system. Much essential data in Victoria and currently is not collected, not used or not made available in convenient forms, limiting hospitals and clinicians' ability to use information to identify opportunities for improvement and strengthen care." Furthermore, on page 188 of the report it states, "Electronic patient records are expected to transform the capacity of the system to study and improve safety and quality of care. Research shows electronic records can improve information flows between hospitals, make it much easier to measure, manage and coordinate care and reduce the risk of clinicians misreading forms and providing patients with inappropriate treatment as a result. Some studies show the introduction of electronic record systems has been associated with significant quality improvement, including declines in length of stay, infection rates, mortality and medication errors. Speaker, that is why this report was very clear in recommendation 4.13, stating, and I quote again, the department should support Victorian public hospitals to transition from paper-based to electronic patient record systems developed to support clinical decision-making and data capability, which have proven benefits for safety and quality of care. The department should adopt a goal of ensuring that all major public hospitals have fully electronic health records that enable interchange of information with other hospitals. Speaker, this bill will ensure we implement a new modern information system as recommended by the Target Zero report across our health system in a manner that optimises privacy and safety for patients. Locally, Speaker, this bill will have benefits for my local health sector workers, residents and patients across Pascoe Vale. As I said in my first speech, it is health workers and community workers that make up the biggest industry of local residents in my area that they're employed in. Almost 14%, or that's almost 13,000 residents. Almost 5,000 local residents alone are employed in hospitals, making up 4.8% of our local workforce. Many of these workers are the backbone of our hospitals, social services and medtech sectors across Melbourne, including at Parkville, the Austin, the Northern Hospital precincts as well. Improving data and information sharing capabilities for my local health workers, who I trust to have access to this information across these sites, will help them do an even better job. For patients, the bill also provides numerous benefits. As the member for Pascoe Vale, most of my constituents who would need to visit an emergency department or hospital would likely go to the Royal Melbourne, the Royal Women's, the Austin or the Northern Hospitals. For the little ones, it's the world-renowned Royal Children's Hospital, which we're so lucky to have on our doorstep just in Parkville. If a local family is visiting a regional area over the Easter or Christmas breaks and needs urgent medical attention for whatever reason, and they're required to visit a regional health service, this bill will be about ensuring our health workers across the state have the tools and information they need in a modern, efficient and pragmatic way so they can do the job to support local patients from my community. If a local patient presents to an emergency department in an incapacitated state or an accompanying family member is unable to fully recall a patient's health history, the measures in this bill will help to ensure health professionals at these critical times have the immediate background and history they need to treat a patient in an effective way. I think my local residents would have an expectation and presume, as the member for Geelong actually mentioned yesterday in this debate, as did the member for Brunswick, that our hospital systems would already be able to effectively share this health information, including in the event of a patient transferring between hospitals. Locally, Speaker, this bill will also benefit the high number of elderly residents and those of non-English speaking and culturally diverse backgrounds whom I'm so proud to represent. With over 17,000 local residents across Marybeck aged 70 years and over, or 10% of our local population, and 35% of residents speaking languages other than English, including 5% of residents not speaking any English at all, Deputy Speaker. That's 8,000 local residents in my municipality. This bill will play a crucial role in overcoming language and comprehension barriers at critical times for so many vulnerable people in my community. As outlined in the 2021 ABS census, Deputy Speaker, the residents of Marybeck also experience a range of health conditions, many of which would likely be the cause of presentations to hospitals and health services. Almost 19,000 local residents experience a mental health condition, including depression or anxiety. That's 11% of locals compared to 8.8% on average across Victoria. 8.6% suffer asthma, 6.8% suffer arthritis, 4.3% suffer diabetes, 3.1% are diagnosed with heart disease, 2.3% have some form of cancer and 1% have a lung condition. Locally, Speaker, I have a number of long-standing local health services that I would like to also acknowledge and pay my due respects to for their ongoing work who seek to benefit from this bill and our broader health reforms. Mary Community Health is the second largest local employer in my electorate, employing up to 500 health staff and proudly provided health and wellbeing services for Melbourne's North for almost 50 years. Mary Health is also one of the state's largest not-for-profit health providers, having last year alone provided over 270,000 unique service contacts, including having administered over 4,700 vaccinations and conducted 22,000 COVID tests. I was pleased to have had the Minister for Health visit Mary Health in July last year that announced a $236,000 grant towards the purchase of new medical equipment. Speaker, Mary Health's work will continue to play a critical role in improving the local preventative health and wellbeing outcomes. I look forward to working with them, including in the context of the proposed Coburg Health Precinct, which has the potential to create a further 1,000 local health and community service jobs and improve local health services. I would also like to acknowledge, Deputy Speaker, the John Falconer Hospital, situated on Moreland Road in Coburg, which first opened its doors in 1939 and has continued to provide critical health services and care for residents of the North. Today, John Falconer provides 186 beds for major and acute health conditions and a 24-hour emergency department. Speaker, I commend this bill to the House, and I'm just so proud to be part of a Labor Party and a Labor government as well that has supported such big health reforms in the past, whether it's Medicare, the NDIS, or the introduction of free nursing and health services, or whether now it's through this bill to improve patient information and sharing systems across our health network, it's Labor that has always backed in our health system, our health workers and patients. As I said, I commend the bill to the House and I thank the opportunity to contribute to the debate. Thank you.
The member